Welcome, Evan.
Hi.
I look forward to spending time with you today to discuss vaccine management. We all know that the best way to defeat the pandemic and reduce the suffering associated with it is to get citizens vaccinated as quickly as possible. This requires a major effort by provider organizations and other sites where people can get vaccinated to establish processes to identify, contact, and register people for vaccination, deliver those first dose jabs, and schedule those same people for a second dose. In addition, organizations must record and report any adverse reactions to the vaccine. Analytics can play an important role in this effort. Can you provide us with an overview on how analytics can help us administer vaccines effectively?
Absolutely. Thank you, Dr. Chaikin. So the way I see it is analytics plays a very critical role in vaccine management overall, not only in the healthcare system or hospital system, but also in general for every business in America. We have to understand that this is a unique situation where we're going to need information around who's been vaccinated, who's been scheduled to be vaccinated, who's had an adverse event like you already brought up, tracking those adverse events. Within the healthcare system, we need to know of our employees and patients who's been vaccinated. It becomes complex. You're looking at things like anywhere from supply chain management to appropriate storage and handling of the vaccine itself. These can all become issues that you need to track internally so that you can report on this type of information, make your processes better, but really at the crux of it, it's to get as many people vaccinated as humanly possible during this time frame, but doing it effectively to where we're not wasting doses. We're making sure that people, that when they get their original vaccination scheduled and performed or administered, that they're getting that second dose the next 2 weeks. They're getting that appointment scheduled, getting that vaccination as well, so that we can get back to our normal lives before this pandemic.
As most provider organizations already use EHRs to guide and document patient care, are they the right tools, meaning EHRs, to use in the management of vaccinations?
Yes and no. They are critical to get information. Speaking from personal experience, we log every administration of a vaccine or immunization record within the EHR. So that's where we get a lion's share of data for patients. Well, where you run into problems is a lot of your employee records aren't necessarily stored in your EHR. Now, they can be patients as well in your system, but that's not always the case. So you have to find alternative ways to get that data, understand of your employee base who's been vaccinated, maybe linking to employee health system or employee health software or third-party application, so that you can understand and help manage that process better. But all the clinical information, like things like comorbidities, understanding how to prioritize patients, all that type of information is going to come from your AHR. And so it is a critical piece in vaccine management, but it's not the standalone answer, particularly as it comes to analytics, because we have to get data from a lot of different sources to create a more robust reporting system.
If vaccine management programs will vary whether an organization is vaccinating an employee, staff member, or a patient, how do you recommend these organizations start keeping track of their jabs or their immunizations?
Absolutely. So for patients, it's relatively easy because we'll get that information from the source EHR record. If they do get the vaccination elsewhere outside of our healthcare system, but there must be some sort of capability within the EHR in order for that patient to provide that record of vaccination to their primary care provider. With employees, it becomes a little bit different, and the fact that we have to do everything in our power as a hospital system or a healthcare organization in order to track those employee vaccinations. So whether that's with some employee health record, a system, or third-party application, and tracking that information, there's a lot of companies that have released that sort of software to kind of give you a vessel to track employee vaccinations. or it could be as simple and as manual as keeping it in a spreadsheet. But we need to track this data some way so that we can pull that information in, understand who's been vaccinated, who needs a second vaccination, who had maybe an adverse event. We also dial it down to different lots of the vaccination to understand if they did have an adverse event, is it because of this particular lot or is it because of a different reason, medical reason? So it becomes complex, but you certainly have to segment your employee from your patients, and you have to track them a little bit differently. But it's more important right now to make sure that we get all those employees vaccinated because they deliver the care ultimately to the patients, and we want to help them first so that we don't have a scheduling problem with or staffing issue.
We know that there are a lot of data sources that are available that can be used for a variety of things: social determinants of health, health disparities, locations that are not having access to care. But what other of the data sources are available to analysts who are building dashboards for vaccine management? How can they use some of these newly available data sources?
Well, that's a great question. I think that most notably, when you look at anything that deals with public health, the more information that you can glean, so whether that's social determinants of health that you brought up, or any other data that might predispose someone to getting COVID-19 or being more sick or having a greater adverse event to the infection itself, we want to be able to monitor patients, and monitor our populations, and understand this disease, and understand how our vaccination efforts are actually making an effort to dent some of these infection rates. So any sort of data we can get, whether that's inside our hospital walls or outside, um, any sort of information that we can bring in that we can locate and link to a particular vaccination or understand a particular population of patients that might need to be prioritized first, because the reason we do analytics is to get information and that we can turn that information into actions to actually change the outcome for some of these individuals. So it's pertinent that we look at things like supply chain. We look at things like storage and handling. It's becoming even a bigger issue with these particular vaccinations because they do have such specific storage and handling. And then we look at scheduling practices. We look at staffing. All these things are sometimes done out of a primary EHR or outside of it. So we need to be able to absorb all this data, conform all this information, and be able to visualize it in a way that's high level, but we have a great understanding of how well we're doing with the vaccination process, how many people we're actually getting vaccinated, and those patients or employees who also maybe refuse. Some of the things that we haven't interpreted, we don't know what we don't know, and there's going to be a lot of information that comes across through this process, and even afterwards. How do we track patients after this? Because we don't know what the long-term effects of this vaccine are. So right at this point in time.
How does the administration of two or more types of vaccines and the requirement of 2 doses for some of those vaccines complicate a vaccination management program? And how do you see analytics helping here?
It comes down to two things: staffing and scheduling. So when you have these particular issues and you're looking at vaccines, different vaccine manufacturers that have different storage and handling, have different administration rules, those are really complex problems. And in order to track it, particularly to make sure that someone gets their second dose at the appropriate time, or that we're not wasting doses. This is a precious commodity right now. So every opportunity we have to vaccinate a patient, we need to do that. Or every opportunity we have to vaccinate another person who wants a vaccination, or who's appropriate to receive the vaccination, we need to be able to manage that. And the best way to do that is to visualize it through data, to understand who has been vaccinated with what particular dose, what particular manufacturer, so that we can understand the required efforts in order to schedule that second dosing or that second administration appropriately. And we can get as many people vaccinated as we possibly can with the supply that we have and make sure that we use it effectively and efficiently and don't waste anything.
I absolutely can agree. The last thing we want to do is waste any of these vaccines. We've seen some of that happen in the last several weeks. Clearly, we're early on in our vaccination programs, and we have a lot more to do, but it's great that analytics would be able to help in this particular area and make sure that we use every single drop of every vaccine that's in each of those vials. We know that the state and federal mandated vaccination requirements exist. What should organizations do to streamline this work and further ensure its accuracy, which we know is very important to the state and federal government?
Yeah, I mean, you have to make sure that you have the capability to capture all the data elements that are required. They're pretty basic data elements. You know, we've been tracking immunizations, vaccines for decades now, and it's no different with this vaccination, except that this whole process came on so quickly. So it is a lot of vaccinations at one particular time, a lot of different doses, but we need to make sure the workflows are there for the providers, for the nurses, physicians, so that they know they can track these data elements appropriately, that we're getting all the information we need. So analytics always shines a light on things or workflows that you can improve upon, particularly as it comes to documentation within an electronic medical record or anything else, or any other system, whether it be supply chain or excuse me, employee health resources. We need to understand where these data elements exist, do they exist in our system, and what can we do to improve it. So if we see a glaring weakness where we're not getting the appropriate information that we need to publicly report to state or federal guidelines, we need to make sure that we're up to speed there. So that might require some build, some analytics that you will show how you can improve that workflow and how you can improve that process to capture those particular data elements. But for the most part, a lot of the things that we know, we already know how to capture. We just have to make sure, because given this situation, it is such an expedited event, that the scheduling processes are done accurately, and so that you know that all the documentation that you need for each particular vaccination can go out and be publicly reported, so that we can track that overall and we can see how well we're doing as a country, not only just an individual organization.
How can analytics help with vaccinations, clinical and administrative workflows, and who should be receiving those dashboards, that analytics?
Yeah, and this kind of piggybacks on what we just talked about. It's that you have to look at how well you can take a patient through this process, and really, anyone who's on a task force for this vaccine program in their particular organizations, whether it's a hospital or healthcare system, you're going to need to know: do we have all the appropriate workflows set up so that I can schedule a patient, I can administer that vaccination, I can see if they're document if they had any adverse events, if they refused the vaccination to begin with, were they appropriate or were they not appropriate clinical necessity because they maybe have some underlying issue where they couldn't take this vaccination, and then move forward from there to really take these analytics up to a high level, so an executive level. So I imagine there would be some sort of executive dashboard that says, hey, this at a 50,000-foot view, these are how many patients that we service, or these are how many employees we have, and this is how many individuals have been vaccinated, this is how many individuals have had an adverse event, this is how many doses we have not wasted or wasted, these are the number or the type, lots of vaccinations that we've used, from whether it be Pfizer, Moderna, or any other vaccine company that comes out with a new vaccine. We really need to understand that information, make sure we're capturing everything, and apply those analytics and those visualizations and dashboards to the executive level, but also to the operational level, so that directors or individuals that are tasked with this particular process of vaccinating their employees and patients, so that they have a well understanding of how well they're doing currently and what they can do to change in the future.
As a clinician, I'm sure you have your personal beliefs about which key metrics would be most impactful for someone who's has your background in administering vaccines. Can you give us some examples of what metrics you would want to see and how that might impact what you do or do not do overall in either
Yeah.
individually with patients or generally in a clinic?
Yeah, my big thing would be, as I administer, particularly to employees. So, when I was a nurse, I always got my flu vaccination every year. Um, but I would want to know for this particular vaccination, of those particular employees, are we increasing or keeping our staff at a good level? So are we having the same issues that we had before? Are we seeing any infection rates or any outliers where someone who was vaccinated turns in a positive COVID test or gets sick? How can we track that information, but also look at things like adverse events? Because that is, I've said this several times, but we don't know what we don't know quite yet. It's very safe, this vaccine, from what I hear of all the literature and all the research, but you still have to look out for things that I would want to track, or do we have any adverse events? How many people outright refuse this vaccination? And then how can I convince them that this is for the betterment of the population? It's also for the betterment of the organization, and to ultimately save people's lives. And I really think that that's got to be the main metric: is, are my infection rates dropping? What am I looking at from a clinical standpoint? I vaccinated all my employees. Am I still keeping the same staffing levels? Am I able to keep up with the demand that the public is ultimately going to give me, particularly as a new administration comes in and maybe we release all these vaccination doses at one point in time? It's going to become a bigger issue to where we got to have the staff to administer these immunizations or these vaccines to the public, to patients, and to employees.
I've read some data recently that suggested that in the state of Ohio, 60% of nursing home staff refuse to be vaccinated, while in the state of Massachusetts, where I live, it's only 10%. How We now know that about 30% of the general population has no intention of being vaccinated. How
Yeah.
could we use analytics to provide information to either workers or the general population to help them be more receptive to being vaccinated and understand the safety associated with vaccines?
Yeah, absolutely. And I think it's critical, just as a consumer, as someone who would potentially get the vaccine, I would want to know, what are the research efforts as we start to roll this vaccine out? Have you seen adverse events? I think that that's what people are worried about. That's what people are concerned about. My wife and I are both nurses, and she worries about the long-term effects of pregnancy, or if you're of that age and you want to have children, will this have any sort of effect on you? Those are things we don't quite know yet. We can always speculate. There's a lot of science and research that are being done concurrently as we start to roll out this vaccine. But that is how someone understands or feels more comfortable getting a vaccine. If everyone gets it and no one is showing any adverse events and it wipes out COVID, people will be more receptive. And you mentioned Massachusetts versus Ohio, or I think you said Massachusetts, but um, it's just different. It's also, this has become a political conversation too. And as you kind of cross the country, you have varying opinions based on that, state by state. And I think that's why you sometimes see that discrepancy. But also, as more and more people get this vaccine and it's seen more safe from a public vision, I think you'll see that number decrease, where people will refuse it, and it'll become part of everyday life, just like the flu vaccine, just like smallpox, like all these things that in our past, that we've been able to manage.
Organizations have used analytics to track COVID-19 infections using geomapping of the positive cases. What's the role of geomapping of vaccinated individuals?
I think it'd be very, very interesting to. So I know that personally that when COVID first started, we used a lot of geo mapping for testing to understand case and infections, and we can use that same information and match it up or map it with who's been vaccinated. So if you get a geolocation of a particular patient or employee, or anybody in that population who's been vaccinated, if we understand where they live, where they come from, what community they service, and understand the infection rates, if we can see a correlation between the decrease of infection rates, the decrease of actual COVID positive cases, as opposed to those individuals or that area that's seeing a high number of vaccines administered, then we can start to say, hey, this is working. And we can finally maybe get back to our lives before this pandemic started.
I suspect that you've developed a variety of dashboards to track vaccine and manage vaccine immunizations, excuse me. Can you give us some examples of what content's in those dashboards and how people have started to use them?
Sure, sure. So what we like to do is we like to start with the initial population. So and break those and segment those groups together. So we track employees separately from the patients. And then we need to prioritize and segment those patients. So what are our highest risk patients? Because we want to get to those individuals first. So we set up some sort of high level algorithm. We base it off of state data to understand who should be given the vaccine or have the opportunity to be vaccinated first. And then we develop that information, provide a high level dashboard that shows you first dose administrations, whether or not they had an adverse event with the first dose. If they did not, then they move on to the second dose. Were they scheduled for the second dose? Those individuals who had an adverse event on the second dose. So we want to track that. We also want to track the individuals that refused the vaccine, that were offered it but refused it. And we need to start to understand why. So what is the patient's sentiment around these vaccinations that could possibly encourage an education to these particular patients, to this particular region, whatever it might be, to help them understand, what can we do, what can we provide you with to understand that this vaccine is safe. Um, and then we also want to track, from the supply chain standpoint, how much of the vaccine we actually have at hand, how many doses, are we appropriately handling these particular doses? Do we have the staffing to administer? So if you have mobile designations or mobile units to where we're providing this vaccine that's associated with our healthcare system, we want to be able to provide this particular visualization, these analytics, to help organizations manage that. So yeah, at the end of the day, it's a lot of what we've already kind of discussed is that you need to be able to track all these different data elements. And at the end of the day, these visualizations will help you make these critical decisions in a timely manner. Now, no matter where this data comes from, so if it comes from a spreadsheet, if it comes from your EHR, if it comes from a data warehouse, we want to pull in all available information because this is a critical moment and junction in our country. And in order for us to move forward, we need to understand how well we're doing. So
Healthcare has always been managed by data, knowledge, information. Analytics, which comes from the data, is a way for us to have evidence-based, unbiased information that we can use to make our decisions. Healthcare is driven by the concept of science. Thank you, Evan, so much for sharing some of your thoughts about that and about how we can work together to address the issue of COVID-19 and get our populations, staff, as well as the general public, vaccinated against this horrible pandemic. Again, thank you so much for your time today, and you have a great rest of the day.
thank you, Dr. Chaikin. You have a great rest of your day as well.